So hello friends, in our previous video we have discussed about second generation cephalosporin. So in this video we are starting with the third generation cephalosporin, and this third generation cephalosporin includes a number of drugs, okay, starting with the cefdinir, cefditoren, okay, cefodoxime, then cefoperazone, then moxalectam, ceftriaxone, ceftizoxime, ceftazionin, okay, ceftrixime and ceftibutin. Okay, you can remember by Delhi PMT exam. So D for this dinir, ditoren, doxime, okay, and P for perazone, and M for moxalectam, and T for traxone, tixozyme, and tazidine, okay, and this X for exime, and one more you have to remember, that is ceftibutin. Okay friends, now what is the antimicrobial activity of this third generation cephalosporin? So E. coli, Klebsiella, Proteus, Haemophilus influenzae, Moraxella, Citrobacter, Enterobacter, Serratia, Neisseria gonorrhoeae. Activity for Staphylococcus aureus, Streptococcus pneumoniae, Streptococcus pyogenes comparable to first generation agents. Okay, so this is the antimicrobial spectrum. Now coming to the first important drug, that is cefodoxime. Okay, this is very important. T half is 1 hour, and this is the shortest. Okay, and it is administered every 4 to 8 hours for serious infection, that is cefodoxime. It is metabolized to des-acetyl cefodoxime, okay, which is less active in nature. Okay, so it is metabolized to des-acetyl cefodoxime. Now next important point, okay, concentration remains good in CSF, so we can use it for meningitis also. What are the indications for the cefodoxime? So meningitis, then life-threatening resistant hospital acquired infection, then septicemia, and it is alternative to ceftriaxone for typhoid fever, and it can also be used for urethritis. Okay, so these are the uses of cefodoxime. Now the next drug is ceftriaxone. This is longest acting cephalosporin. Okay, T half is about 8 hours. Now it is drug of choice in the cases of gonorrhea. Okay, but treatment of choice for gonorrhea is ceftriaxone plus azithromycin or doxycycline. Okay, so treatment of choice for gonorrhea is ceftriaxone plus azithromycin or doxycycline, and drug of choice among this is your ceftriaxone, as we have written here. Now ceftriaxone resistant gonorrhea, then the drug of choice will be spectinomycin. Okay, if that gonorrhea is ceftriaxone resistant, then drug of choice will be spectinomycin. Clear? Now this is also, ceftriaxone is also drug of choice for E. coli, Klebsiella, Providencia, then typhoid, then meningitis. Okay, empirical treatment of Haemophilus influenzae and meningococcal also. Okay, it is also drug of choice for typhoid. Okay, oral drug of choice for typhoid. Okay, so this is about your ceftriaxone. Now what are the side effects associated with ceftriaxone? Is your hyperthrombonemia, and due to this there will be bleeding and hemolysis. Now the next drug after ceftriaxone and ceftriaxone is ceftazidime. It is drug of choice for Pseudomonas. This is very important question, that drug of choice for Pseudomonas is ceftazidime. Very important. Okay, now treatment of choice for Pseudomonas is ceftazidime plus aminoglycosides. Okay, treatment of choice for Pseudomonas infection is ceftazidime plus aminoglycosides. Drug of choice, it also acts as drug of choice, that is ceftazidime is also drug of choice for melioidosis and febrile neutropenia. Now the next is ceftolozane. It is analog of ceftazidime, okay, and it is used as anti-pseudomonasal activity. Now side effect is neutropenia, thrombocytopenia, increased plasma transaminases, and blood urea. Now the next is your cefoperazone. This is anti-pseudomonas. It is good for Salmonella typhi and Bacillus fragilis. Okay, what are the indications? So urinary, biliary, respiratory, skin soft tissue infection, typhoid. So these are the indications of the cefoperazone. Clear? Now the next is your cefixime. It is oral drug. It is highly active against Enterobacteriaceae, Haemophilus influenzae, and Streptococcus pyogenes. Side effects are stool changes and diarrhea. The next is your cefdinir. Good activity against many beta-lactamase producing organism, and the use of this drug is for pneumonia, ENT, and skin infection. Now coming to the fourth generation. So fourth generation basically is for cephalosporin and used for resistant gram-negative bacteria. It includes cefepime and cefpirone. Okay, PIPI for fourth generation, cefepime and cefpirone. So coming to the first, it is cefepime. So it is used for is highly resistant to beta-lactamases. Okay, active against resistant gram-negative but not MRSA. Used is hospitalized acquired pneumonia, febrile neutropenia, bacteremia, and septicemia. Okay, cefpirone is also used for the treatment of serious and resistant hospital acquired infection. Now fifth generation is used for resistant gram-negative, gram-positive MRSA plus ESBL organisms. It includes ceftaroline and ceftobiprole. Okay, ceftaroline fosamil and ceftobiprole medocaryl. So these two drugs are coming under the fifth generation. Coming to the first, it is ceftaroline phosphamide. So active form is ceftaroline, okay, by action of phosphatase within when taken through IV route, okay, the active form will be ceftaroline. It will contain to ceftaroline. Now it is cidal, okay, cidal to gram positive, gram negative, clear. Now the next is use. So it is used for complicated skin and soft tissue infection, community acquired pneumonia, and resistant staphylococcus pneumonia. Pharmacokinetics involve kidney elimination, and T-half is usually 2.6 hours. Side effects: headache, dizziness, rashes, and fever. Now coming to the general side effects of cephalosporins. So pain after IM injection, diarrhea, hypersensitivity reaction, the most common, nephrotoxicity, okay, low grade and rare, bleeding due to hypoprothrombinemia, then neutropenia plus thrombocytopenia, and disulfam like reaction. So this is all about your cephalosporin. Thank you.